Hello everyone and welcome to Inside Healthcare. We'd like to give a big shout out to our new Inside Healthcare viewers from Cannon Falls watching us on Channel 12. We're glad to have you with us along with all of our great viewers from around Minnesota. Thank you everyone. In this program, we will be talking about a special new addiction program which is now available in Minnesota. And later in the program, we'll tell you about some unique new cooking classes that we think you might find very delicious and good for you. But first, in local healthcare news, cancer patients in Woodbury and surrounding communities will soon have a radiation therapy facility in their community for the very first time. Recently, we sat down and talked with a Healthy senior leader, the mayor of Woodbury, and a local cancer doctor about this new cancer center and 2 new primary care clinics in Woodbury. Here's what they had to say.
We're really excited about the project that we're doing out here in the Woodbury community. And the Woodbury community and Health East have had a long-standing relationship of growing together that kind of dates back to the creation of the Woodwinds Health Campus and engaging the community in terms of what kind of services would they like to see and how would they like to see them on this campus when we built Woodwinds Health Campus. And that formula has certainly worked for us with significant success and positive feedback from the community. So this next expansion is really an extension of additional community growth and Health East's ability to grow along with what those needs of the community are. So part of this project is to take our Woodbury clinic that currently exists in the medical office building that's attached, and we're going to bring about 10 providers or so from that clinic over to the eastern side of Woodbury, which is where the significant population growth is, and create a clinic there to meet those growing population needs. And then the other half of the clinic will be relocated to the Oak Center right here on the Woodwinds Health Campus. And we have an opportunity through that clinic relocation to really do a creative and innovative design where we're going to integrate the clinic, Ways to Wellness, and Optimum Rehab that's currently located in the Oak Center. So that'll be a fun project to do as well. And then we're going to take the space that we are vacating from the clinic and create an oncology center. And the oncology center too will be designed with patient feedback and create some of the unique qualities and features that people have come to expect from Health East and specifically from the Woodwinds Health Campus. The real construction is going to start within the next 30 days, and we should have our first clinic on the eastern side of Woodbury. We expect construction completed in the fall time frame, so we hope to open that clinic in the September-October time frame to start serving patients there. At the same time, we'll be doing some construction here on the campus next to the medical office building to create the radiation therapy capability, which is something that's unique to this community and something that drove the exception to the moratorium to allow Health East to bring radiation therapy to serve Woodbury residents. And once the Woodbury clinic on the east is open, we will then begin construction in January of next year on the Oak Center to design the primary care clinic here on the Woodwinds campus. And that'll take probably 6 or 7 months during calendar year 15 for that clinic to be completed. We will relocate the primary care staff that's in the Woodbury clinic in the medical office building into the Oak Center, and then we will complete the oncology center construction by the end of calendar year 15.
That we're also very excited about. This expansion will grow with a growing community. Woodbury is now the 10th largest city in the state of Minnesota. We're at 65,000 people and growing, so very happy to have Health East join us in that growth. This expansion for your cancer center is something we've supported and envisioned for quite some time. That there would be a location within this community to service not only Woodbury, but really the whole area for full service treatment for cancer. And so with this expansion, on this campus with the environment that you've got. So looking forward to seeing those plans and seeing that come to fruition. And then of course with that growth, you're adding the clinics to meet those needs as well. So thank you for your continued investment in the community and for your continued involvement. You've really been involved, and we look forward to that continued partnership.
It's because of your support and your vision that's making this happen. And as a radiation oncologist, I completely understand the complexity of getting a new treatment machine in a facility. It's not an easy thing to do. It took a lot of work, a lot of collaboration, and I'm so grateful to all of you that's going to allow this to happen to the community, that we can service you.
A project of this magnitude with this many dominoes and moving parts does create a lot of change. And change can be difficult, but it's also really exciting, especially when a community like Woodbury embraces us the way they have in the past. And I just think it's thrilling for us to be able to grow along with a community that's as thriving as the Woodbury community, to grow right along with them and expand our capacity and capability in the primary care area as well as oncology services.
Health East officials estimate that the new cancer center and the 2 new clinics will be about a $20 million expansion project. Now we turn our attention to a special new intensive outpatient addiction care treatment program for the LGBT community called L.I.F.E, which stands for Living Independently, Free, and Empowered. We're very pleased to have with us Christopher Ackerman. He's the Health East Outpatient Chemical Dependency Counselor Lead and the L.I.F.E Program Counselor. Thank you, Christopher, for being with us. And we're also joined by one of his clients, Jim. So we appreciate you being with us, taking time, and especially sharing something that can be very personal in such a public way. So we really appreciate that, Jim.
Thank you, Jody. Thanks for having me.
Really appreciate it. Why don't we start off with Christopher? Why don't you tell us, what is L.I.F.E? What is that program all about?
The L.I.F.E program is a specific chemical dependency or addiction care program specifically for the LGBT community, which means lesbian, gay, bisexual, and transgender. What research has tended to show is that for LGBT people in recovery, that it's important that that aspect or any concerns related to sexual orientation or gender identity are addressed as part of their addiction treatment in order to help them successfully recover. And people that don't get that tend to be less successful in their recovery.
And Jim, how is the program helping you so far?
Well, it's a unique program. I've been in other outpatients and inpatient programs over a period of time. Because I am gay, I would say about 99% of the people, or closer to 100%, are not gay. So consequently, to feel free to explain or discuss specific needs, it's just a new concept, and it's wonderful. I could go in there and say what's out of my mind. I don't need to go in there and weigh words and try to present it in a way that I think would be acceptable for straight people to understand. I'm very, very welcomed by the heterosexual community. I'm open to everyone, but yet this is unique, where I could come and I could talk. We have a wide variety of people there, even though the groups are small. We're a diverse group within a diverse group. We do have gay people, lesbian, bisexual. We even have a person that's considering transitioning. Thank you. And even from a spiritual standpoint, we meet with Laura Rose, who is just a wonderful inspiration, and we could talk and we can tie the things together, and that's so important for us to be able to have that connection with our higher power, whatever it may be. Our higher power, to me, I am a Christian. We have a Muslim. We have people that border on, is there really a higher power? What is my higher power? So, we're a diverse group, and it's very comfortable to go there. It's just an exciting, I look forward to it every day that I can be there.
And the program just started. It hasn't been around very long.
It
a
just
few
opened
weeks.
on November 4th of 2013, so just a few months now.
So how does the program work, and why specifically? You said the research says that this is really helpful in the community with people with addictions. Why
Yep.
is that?
The LGBT community tends to experience equal or increased levels of substance abuse as compared to the heterosexual community. Similar trends are found within mental health diagnoses. So we found that to really help our community, we really wanted something specific to a specific culture to give people in our community, the LGBT community, the best care that we could.
So again, how does the program work? What are some of the things? He
program
mentioned a little
works-
bit about some of the meetings and things.
What we structure it is we have a 3-phase program. So it's kind of a step-down program. At first, it's very intensive. People come in 4 days a week for 3 hours of group. And then the next 3-week period is 3 days a week for 2 hours, and then steps down to 1 day a week. So it's about a 3-month program supplemented by a 3-month relapse prevention program. And individually, every week, people who participate in the program get an individual session with me as their counselor to look at the individual needs that they need as a part of their recovery.
And you had mentioned before we went on that you're working with Healthy's Ways to Wellness
Yes.
as well. How are they helping out with the program?
Ways to Wellness has started off by pairing with us on one of our relapse prevention programs, incorporating more of the mindfulness approach that is a part of our L.I.F.E program as well. And we're looking to expand that as we have more and more successful cohorts from our mindfulness relapse prevention program to transition that same curriculum over to the rest of our addiction programs at Health East.
So when you first heard about the program, were you excited, apprehensive?
I was excited. I wasn't apprehensive. I was had the opportunity to meet Chris when I was inpatient at St. Joe's Hospital, and he came up, and I felt very comfortable with Chris and the program as he explained it, and so I was real excited because I foresaw what it would mean. It would be a chance, and I was kind of the first person in the program.
Oh, wow. I
I
didn't
joined
realize
very
that.
shortly thereafter.
He was.
And I felt welcome from the moment I stepped in to the program. Even before we would, Chris and I would have conversations, and I think that everybody that comes into the program has that feeling of being welcomed, and it's just an exciting thing to know that you have a place, know that
Absolutely.
you can be free to talk, and and we could be serious, we could be spiritual, we could laugh, we could do, and there are times that all of those emotions happen. I have, in addition to my alcoholism, I have a sexual addiction, and Chris and I, and Chris and every other person in the program has a one-on-one once a week, and we're able to talk about those things. And he has helped me to look for and obtain a therapist, a private therapist that will help me with that, because my addiction, plural addictions, interact with each other, so I have to address both of them. And I think that anybody that comes in, regardless of where you're at in the spectrum, you will feel very, very comfortable and welcomed.
And I would think that multiple addictions is very common, isn't it?
Absolutely.
It's not usually one thing or another. What would be other things that you want our viewers to know about the program?
Well, as far as just insurances and different paying options, I think is an important thing for people to know, that this is something that insurance companies, private insurances, will fund for. Also, if people fall under a certain income level, that they can do what's called a Rule 25 or chemical health assessment and receive county funding to get chemical health treatment. And we also
That's good to know, yeah.
we also include a self-pay, and then through Health East, based on incomes and assets, that you can get discounted treatment or free based on your income.
And Jim, what would you want our viewers to know about the program from a personal side?
I think that what I really like for them to understand is that you are welcome, that you are integral piece of the program the minute you step through the door. It's all inclusive, regardless of where you're at in your journey in life. You are welcome, you're understood, you're free to express yourself. I think that's so important because I've heard people come in and say, you know, this is just incredible that I have the freedom now to speak as, you know, I want to. It's a wonderful program. And I have to thank
Jim.
Chris and, you know, St. Joe's. What outreach to a group of people that really need your help and stuff. So thank you.
Thank
So
you.
if someone wants some more information about the program or how they can learn about it?
They could call myself at 651-326-4123, or they could call our intake office coordinator at 651-326-3645. And both of us would be more than happy to provide that immediate feedback and questions and answers. We feel like this is one of the biggest decisions you'll make in your life, and that you should have questions, you should have answers, you should have people that have that desire to meet you where you're at and get an informed decision on the next step that you're taking.
I love that the name of it is Life. You know, it's so
Yeah.
cool. We just have a second left here. Jim, final comments?
I love it, and come on, everybody. You know, our doors are wide open, and you know, you'll like it a lot.
All right.
Pretty good first client.
And I'm not
Did
getting
you pay
paid for it either. No.
The expectations are now pretty high.
Right.
And final comments from you too, Christopher.
Well, I think we just have a new opportunity here at Health East. We're looking into doing a lot more specific community-based treatments as far as not only the LGBT community, but the CRIN program, the senior community, just so people can get more specific and individualized care instead of a traditional cookie-cutter type treatment that doesn't really work.
Well, thank you both for being with us, and especially Jim for being with us. I really appreciate that.
Thank you,
and being
Jody.
willing to talk to us
I
about
enjoyed this. And
Oh,
thank
awesome.
you very much.
That's nice to hear, and
Thank
thanks,
you, Jody.
Christopher. And coming up next, we're going to talk about some very cool cooking classes, so stay with us, everyone. Thank you so much. Thanks, Jim.
Are you getting this, honey?
Oh, prime time. We are rolling.
All right, Mama's gonna bring it home. Mama's gonna bring it home. Okay.
Come on, watch this guy.
Oh, backwards!
Oh, don't. Oh,
It went into Bob and Carol's yard. Oh, no? Okay, here it comes.
oh Mom!
Challenge your kids to be active and eat healthy.
All right, let's see what you can do. Let's go.
They might surprise you.
Let's go.
Search We Can for more ideas on how you and your kids can get healthy together.
Welcome back to Inside Healthcare. Joining me now is Krista Reimal, and she's a registered nurse. She's here to talk about some of these very cool cooking classes and why they could be just what your doctor ordered. So first of all, I think people might go, she's a registered nurse and she's talking about cooking classes.
Yes.
Why is that?
Well, Jody, I'm also the Director of Endocrinology and Diabetes Care for Health East, and as we are embracing some new concepts in healthcare as it pertains to diet and lifestyle and making sustainable change, our department's really looked at how we can help people living with diabetes to embrace change and engage their family members and friends and community around them to also make that change to support the patients.
So these have really cool titles and things like Travel the World with Food, Mobile Meals for the On-the-Go Families, for the Love of Carbs, Summertime Cooking and Grilling from Farm to Table. Maybe you can talk about some of these classes.
You bet. What we know with people who live with diabetes is that there's a component of diet and lifestyle that's very important to make some modifications to best manage their disease. And some of these changes aren't easy, one of which usually centers around food. And food is difficult to manage in our society. We live in a time where it's not easy to look at making lifestyle changes. And when a provider tells a patient to make some diet lifestyle changes,
I don't even know if they go that far. Didn't they just
Yeah.
say you should lose some weight or?
and often patients hear that, and that's really frustrating because what does that mean? It leaves a big open window of interpreting that. So we wanted to provide some opportunities for our patients to really learn those skills, and along with that, bring their family and friends to help also embrace that change and learn together. So one thing that everybody has to do is eat. We have to eat every day. It's not something we can usually choose to do. And so that's where we started embracing some change in our department and trying to offer our patients new opportunities. In addition, a lot of the pieces of managing diabetes pertain to food. Patients' medications are timed around food. We ask patients to check their blood
levels,
sugars
yeah.
before or after they eat, sensors and pumps and insulin. It's all timed around food. So that's why we started with giving some new or providing some new opportunities for our patients to learn how to cook and how to eat to best manage their diabetes.
Maybe you could take one of these classes and just tell us a little bit more, like mobile meals to go.
Yes.
On the to-go families.
To-go families. Now you'll see at Cooks on Crocus Hill, there's a lot of variety in the classes that they offer, but what's unique about ours is they are specific to people, family members, friends living with diabetes. It's meant to be really an open learning opportunity for that person's community to embrace these changes. And so we've taken some areas that we know are oftentimes a struggle for patients, such as we have really busy schedules. How do we eat and not end up at the McDonald's drive-thru? So we took a class like Mobile Meals for Families on the Go and have tried to create some very easy, simple, affordable meals that can be made that you can take in the car, you can take on the go, and it will help you avoid driving through McDonald's or a fast food place that oftentimes is going to result in a higher carbohydrate meal intake than advised for managing your diabetes. We've also tried to look at, in March, we're offering a Travel the World with Your Food. It's a class where we're looking at all of those wonderful ethnic foods that we love to enjoy and we should enjoy. We want food to be a positive experience. But it's also helping you make some of those little changes that can make a big difference in terms of keeping your blood sugars in optimal control. So we've looked at hosting a new, kind of a variety of classes that have a different focus each month. And you can really pick one or all of them that really pertains to maybe a change that you or your family is trying to make.
Maybe we could talk about where these are being held. You mentioned briefly Cooks of Crocus Hill. So.
Yes. Correct. Well, as we looked at our current statistics in diabetes, 1 in every 3 Minnesotans has prediabetes or diabetes.
That's incredible.
It is. It's really become an epidemic in our society. And so we looked at some local community partners who were also on this mission of trying to create and promote health in our population. And that led us to Cooks on Crocus Hill and Kowalski's. And so together we've spent months really trying to create these new opportunities that for the first time all of us are looking at these wellness classes that focus on a complex chronic disease, but also really promote living well as well as possible with that chronic disease.
So you're really calling them more wellness classes than cooking classes, even though cooking is a component of all of the classes.
Yes, cooking and nutrition is a component of being well, but certainly we're going to give you tools that can apply whether you're out and about, whether you're in your kitchen, whether you're in someone else's kitchen. We just want to give you more knowledge to be better prepared how to make the best choices possible.
And it also includes some tours of grocery stores?
Yes, correct. We did one grocery store tour already, and it was very well received. Kowalski's has partnered with us on that initiative. And then Cooks on Crocus Hill has two store locations, one in Stillwater and one on Grand Avenue in St. Paul. And every month we'll have a class at each location. And we've worked very closely with their staff and owners and directors there, and they've just been fantastic to work with. And at each class, you'll have Chef Mike, who's very engaging, very fun, offers you some really practical tips on how to cook and kind of enjoy being back in the kitchen. And then along with that, we'll have one or two of our certified diabetes educators at each class. So you can really talk about the real world of trying to live and eat and manage your life with diabetes.
Now, you were talking about like is it just for an individual, or can the whole family come to these classes?
Good question. The whole family is welcome to come, and this is something new that we're embracing. We recognize that we offer a lot of opportunities for our patients to come and meet with us one-on-one with our providers, our certified diabetes educators, but because insurance limits us oftentimes to just caring for the person with a diagnosis, we wanted to create a new platform where your entire village of people can come with you to the class if you choose. Whoever that person might be, we want to really recognize that to sustain change, you often need those around you living life with you or alongside you to also embrace that change.
And you have several classes. You can sign up for one or all of them?
Correct. You can sign up for one, you can sign up for all of them. As a matter of fact, we had one gentleman who went on our grocery store tour in January, and he's already signed up for all of our classes every month. He was so excited. So we're really trying to give people some street smarts on how to really live well with managing diabetes in the real world. And that's what a lot of times we have failed to offer opportunities in regards to, but we're looking at changing that in 2014.
One quick tip that you could give our viewers on reducing the blood sugar levels or watching them?
Sure. You know, obviously watching your carbohydrate intake is important. For most people, that's going to be about 45 to 60 grams of carbohydrates with each meal. But we also want to promote enjoying your food. There's nothing that we say you can't have. It's just learning how to balance your plate and balance your meals. And oftentimes that means reducing your carbohydrates a little, maybe increasing your protein or your vegetables and fruits a little bit. But we give you some really practical ways how to do that and take it a step further by showing you how to do that, by creating a positive experience in the kitchen again.
And before we went on, you said some of the classes are filling up fast, so if people want to sign up, how do they go about doing that?
Yes, if people want to sign up, they can go to cooksofcrocushill.com/healtheast. They can also call one of the Cooks of Crocus Hills or just browse their website, and you'll see Living Well with Diabetes, and that will list all of our cooking classes. You can also call our main diabetes care line, which is 651-232-5757, and you will be met with one of our diabetes care specialists who can help you understand all the classes that we offer, can schedule an appointment with one of our certified diabetes educators, and we also have a great team of endocrinologists that can help you if you're to the point in your disease process where you need to meet with one of our specialists.
Well, these sound like awesome classes, and thanks for offering them.
Yeah.
And putting them all together. It sounds awesome.
You bet. Thank you, Jody, for having me on the show and the opportunity to talk about them.
Thanks.
Thank
Thanks,
you.
Krista. And we'd like to thank you for joining us. We hope you'll join us next time on Inside Healthcare. We'll see you then, everyone.
Inside Healthcare. For more information, visit stjohnshospital-mn.org or call 651-326-7800.